In this upcoming segment, I consult with a CTE teacher who teaches Health Science Technology 1, 2, and 3. The challenges that Sandra talked about include teaching complex and technical medical terminology, checking for understanding, keeping students engaged, and facilitating reading comprehension. The class that we are going to concentrate on is that in which she teaches range of motion. Sandra will primarily apply strategies such as engaged academic time, decoding words using cognates, and modeling reading comprehension strategies. Can you tell me a little bit more about the content that you teach?
I'm the health science technology instructor at the high school, and I teach those students who are thinking about going into the healthcare field one day. Most of them want to be either doctors, nurses, pharmacists, pharmacy technicians, respiratory therapists, things like that.
Okay. And what materials do you use to deliver your instruction?
Primarily in the classroom with my Health Tech 1 students, I use PowerPoint presentations, worksheets, lectures, that kind of thing. But I also have a lab that I use with those students. And in my lab, we do a lot of hands-on activities. I have CPR mannequins, blood pressure cuffs, stethoscopes, thermometers, IV tools, things like that. And my Health Tech 2 students actually do a lot of labs off campus. They do clinical rotations at the College Station Medical Center. They even come here to Texas A&M Health Science Center and do labs. And they also do rotations through a nursing home.
Wow, those sound like really enriching experiences.
The students really enjoy it. They really enjoy it.
So what are some of the concerns that you have when working with your English language learners?
I would have to say with my English language learners, medical terminology can be pretty challenging. Medical terminology, even for English-speaking students, is a whole new language. It's words that they've never been exposed to before. So for a student who's trying to learn the English language, having this other medical language thrown at them too can be challenging.
Okay. That seems to be a ubiquitous concern. I hear that all the time with technical language and academic language. What about some of your other concerns?
I would have to say another concern that I have is informal assessment. Just checking for understanding, knowing that the students understand what's being said in the classroom. I can think of one student in particular, a Spanish-speaking student who's new to our country. He's very shy. And it's very hard for me to assess him to know that does he understand what's going on in the classroom. I think there might be some cultural issues there as well, that maybe in his culture it's not okay to say I don't understand. And so it's hard for me sometimes to know does he, if I ask him sometimes he'll just shake his head yes, but I don't know that he really understands what I'm saying. Also another area that I'm concerned about is reading comprehension, and that's not only with English language learners, but also my native English-speaking students. With this type of material, there's a lot of technical language, and so I don't know that they always understand when we're reading the material.
Okay, those sound like, again, concerns that I hear often from teachers, particularly when students are new to the country. So it is a real challenge to really assess informally their comprehension and to keep them engaged, because you can't gauge whether they are understanding or remaining engaged. And of course the reading material is going to be a challenge in itself. So very interesting. I think we're going to be able to address many of those concerns in a very effective way. Can you tell me a little bit about the material that you plan to teach in the near future?
A unit that I have coming up will be range of motion, and I will be introducing the students to some new vocabulary involved with range of motion.
Okay. What material do you plan to use in delivering this instruction?
With that particular unit, I'm going to be using primarily worksheets, videos, and in-class demonstrations.